Hi everyone. Thanks for joining in. And today, being the World Cancer Day, we are actually doing this session as part of your primary well-being. So the topic you guys already know, it's obesity, diabetes, and cancer. How are they linked? So we'll be discussing it in detail. So before starting with the session, I'll just quickly brief you about Pazcare. So Pazcare is a health insurtech platform that lets you design, administer, and manage the employee benefits program for your employees. So today's session, we are actually doing it along with the Good Health Clinic team. I'll give you a brief introduction about the Good Health Clinic as well. It's a health tech organization that allows affordable disease reversal through personalized and science-led health coaching and physician coordination. The Good Health Clinic is currently based out of US, UAE, and India. And to help you out with all the discussion around cancer, we have Kamal with us, Kamal Parida. He's certified by Stanford University in nutrition science and by MIT in AI and digital transformations. He has done extensive research on chronic health conditions with an international team of doctors and health coaches. Prior to founding the Good Health Clinic, Kamal was working at MasterCard. He worked with McKinsey, ITC in London, Dubai, New York, Singapore, and in India as well. He's an MBA with the distinction from INSEAD and a BTech honors from IIT Kharagpur. So Kamal, I welcome you on behalf of the Pazcare and everyone. So it's over to you.
Thank you.
Start.
Thank you so much, Anshik, and thank you for a very warm introduction. Hey everyone, my name is Kamal Parida. Anshik, just checking, you can hear me properly, right? Everything is audible and right? You can see the screen and everything.
Perfectly audible, perfectly visible, and I hope it's for everyone. Perfect.
Great, thank you so much. So yeah, hi everyone. My name is Kamal Parida, and I'm delighted to be here on this very important subject. I'm the founder of the Good Health Clinic, as Anshik was mentioning. We call it TGHC in short. Our mission at TGHC is to democratize tech-powered precision health for reversing cardiovascular disease and cancer risks, such as diabetes, hypertension, obesity, women's health, and mind health issues. We started in March of last year, so 2021, and in the last 10 months, thanks to our international team of medical advisors and health coaches, our members have reversed their cardiovascular risks by lowering their HbA1c by 1.5 percentage points, cholesterol by 40%, weight and waist size by 10%. And all that while reducing their medications. And I'll go into this much more as we go through our presentation. Before TGHC, again, as Anshik mentioned, I spent 16 years at McKinsey, MasterCard, and ITC in different places. Graduated from IIT Kharagpur and then did my MBA from INSEAD in 2009. So as you can see, I don't really have much of a healthcare background, but I'm passionate about healthcare because of the prevalence of diabetes and cardiovascular disease in my family. So we've had diabetes in the family. We reversed my parents' diabetes 3 years back, working with a very good doctor by focusing primarily on their diet and lifestyle, right? So they managed to eliminate 80 units of insulin a day because they focused on the root cause, which was insulin resistance. Apart from that, I'm certified by Stanford in nutrition science and by MIT in AI and digital platforms. So let's dive in. Obesity, diabetes, and cancer, are they linked and how? We'll answer that question in this webinar, and we'll also look at some concrete steps to prevent cancer in the first place. And I think that's an important theme for us to have, because most of the discourse today when it comes to cancer focuses on early detection. And that is not very helpful because cancers actually exist in our body for many, many years before they become detectable even at a so-called early stage, right? So what we have to really focus on is prevention, not just early detection, also because even if you detect a cancer early, you will still have to undergo a very painful and crippling phase of chemotherapy or surgery or radiation therapy before you can actually so-called get rid of that cancer, right? So if you're a woman and if you get breast cancer, even if that gets detected at an early stage, you will still get several months of chemotherapy, right? If you are lucky. If you are not lucky, you might probably have to undergo mastectomy, right? And so that, as you can imagine, is not an optimal solution. That is, you may be able to survive and that's great, but wouldn't it be better if we knew how to reduce the risks so we can prevent these cancers to begin with, right? And that's what we are going to focus on in this webinar today. I think Anshik has kept some Q&A at the end of the webinar, so I'm going to try and not spend too much time on the pages and try and reserve more time for the Q&A at the end.
Just a small suggestion, Kamal, before you start.
Sure.
If you can turn off your video, I guess there's some bandwidth issue already, so it's better.
Sorry, Anshik?
I was saying if you
Should
can.
I switch off the video?
Yeah,
Okay.
yeah.
All right, yeah. Okay, there we go. So the agenda for today has 5 topics. Number 1, what is the state of cancer prevalence and mortality in India? Number 2, very importantly, why are we as Indians at higher risk? Number 3, what is the biggest risk factor for cancer and what is the root cause behind that, right? Number 4, what can we do to reverse this root cause and prevent several of these kinds of cancers? And lastly, Q&A, right? Just a standard disclaimer, by the way, at this point, which is this webinar and all the information that we are presenting is not a substitute for medical advice, right? So please do not stop seeing your doctor, or please do not challenge your doctor just because of the information you're getting here. This information is supposed to help you to understand how we can prevent cancers, but obviously if you have an ongoing medical condition which requires medical help, you should continue with that. So let's start with some top-down numbers to understand the prevalence of cancers in India and their mortality. 4.5 million people in India in 2019 had cancer. 1 million cancer deaths in that same year. 4.5 million people having cancer in 2019 represented a growth of nearly 200% between 1990 and 2019. So that's roughly a tripling of patients in India having cancer over the last 30 years. Let's think about what is driving that growth in cancer. The obvious answer could be it is population growth. And you will see that also cited in several research papers by medical associations saying, oh, cancer growth is being driven by population and urbanization, right? Well, population growth in the same time frame has only been about 60%, right? So that doesn't fully explain the growth in cancer in those last 30 years. On the other hand, the growth in metabolic disorders is almost equal at about 194%, right? So what do we mean by metabolic disorders? These are diabetes, prediabetes, hypertension, obesity, etc. Is there a correlation between that 199% growth in cancer and the 195% growth in metabolic disorders? Prima facie, it seems so, right? Now, let's look at a different view of this disease. Let's look at the top 20 cancers which are driving this growth. On the left-hand side, you will see in thousands the top 20 cancers in India. On the right-hand side is a graphical illustration by National Cancer Institute in the US, which shows that the top 13 cancers are associated with being overweight or obese, right? So now let's take a moment to reflect upon the fact that mostly we have always heard of cancer as an act of God or an act of faith or something which is caused by smoking or chemicals, right? Exposure to chemicals like industrial chemicals and so on and so forth. But turns out that the number one cancer in India, breast cancer, number two, blood cancer, and number three, cervical cancer, these are actually all more associated with being overweight or obese, much more than lung cancer, which appears way down in that list, which is associated with tobacco, for example, right? So even from a bottom-up perspective now, we can see that there appears to be a linkage between our metabolic health, so our obesity, and cancer prevalence. 15 of the top 20 cancers and 80% of these patients have obesity or diet as a primary risk factor. This page shows another lens by portraying the additional risk that you have of cancer when you have diabetes. So the yellow chart on the left-hand side shows the additional risk ratio that you have of those listed cancers if you have diabetes. So liver cancer in the middle of that list, you are 2.5 times more likely to have liver cancer if you are diabetic versus if you are not, right? So you can see that in most of the cases, your risk is higher by 30–40% if you have diabetes. On the right-hand side is the diabetes prevalence in India. 80 million patients of diabetes alone in India, of which 60% are undiagnosed, which means they have this disease which is creating havoc inside their body. They don't even know about it. Why? Because diabetes does not always show up overt symptoms. Of the 40% who know that they have diabetes, 80% do not achieve their doctor recommended targets like their glucose markers, HbA1c, weight and waist size, etc. Right? So if you add up the 60% and the 32%, which is the 80% or 40%, then 92% of these 80 million people, diabetes patients in India, are either not even aware that they have the disease or they are not meeting their doctor recommended targets, which means they are inevitably having all of these cancer risks in them, and either they don't even know about it or they are helpless against it. The other factor that I want us to all reflect on is this: 80 million patients of diabetes in India. When you add the number of people with pre-diabetes in India, which is the step one before you become full-blown diabetic, and when you add the number of obese and overweight people in India from the previous page, that's more than 50% of India's adult population. So let's take a moment to think about that. What that means is 1 in 2 of us is at a high risk of cancer. And a lot of us are not even aware of that risk, right? You can now join the dots to see why this page has the lead that says the future doesn't look any better. Because Because number one, 90% of us are failing to make diet and lifestyle changes which are required to correct our metabolic health, right? Diabetes, obesity, overweight, these conditions need us to correct our diet and our lifestyle. They are failing to make these diet and lifestyle changes. Why? Because number one, generic guidelines and fad diets like keto and low carb don't work. They might work in terms of showing you some direction in the short term, but they make your health worse in the long term, right? Number two, quality coaches who can provide personalized coaching are costly. They cost anywhere between 10 to 30,000 rupees a month. And number three, behavior change needs ongoing coaching, support, and motivation, right? And we'll talk about these more at the end when we are looking at these recommendations for what we need to change. The result of that is that diabetes prevalence by 2045 is expected to go up by 70%, right, in the next 15 years. So this should go and set all the alarm bells going. What's the second factor why this is a problem still going to? Because the current protocols, the current discourse, as we were talking about earlier, does not place any emphasis on prevention of cancer. The main focus remains on early diagnosis and treatment. And the problem is early diagnosis or treatment can still only lead to suboptimal outcomes, right? We have to think about prevention. We have to think about prevention at an individual level, at a family level, at a government level. Third problem, 50% people who have any of these metabolic health conditions also suffer from mental health conditions. Mild depression is common in patients with chronic health issues. Mood disorders caused by low energy and bad sleep basically mean when you are in a bad mood, chances are you would not want to eat healthy. You would not want to go and do exercise and yoga and meditation if you are depressed or if you have mood disorders. The outcome of all of that is that by 2026, which is just in the next 5 years, we are going to see a 12% increase in cancer prevalence, right? And many more deaths. Even medical associations and medical association journals are saying that the current paradigm has gaps and needs big changes, right? So if you look at this publication, which came out from the Asia Pacific Journal of Cancer Prevention, again, it was placing the growth of cancers on population growth and urbanization and globalization, and the entire focus is on existing diagnostic or treatment facilities, right? And the Nature also says that rather than finding new ways to prevent disease, the vast majority of cancer research is devoted to finding cures. Let's understand, as we were looking at earlier, right? So what is this connection between obesity and cancer? What are the biological pathways which lead from obesity or excess body fat to cancer? The first is inflammation. Too much body fat triggers inflammation. What is inflammation? Inflammation basically is our body's natural immune system response to injury in our body's internal tissue. So if you think about it, acute inflammation is great because that's how we fight viruses and bacteria which are invading our body, right? That's how our immune system gets rid of those pathogens. Chronic inflammation, which is what results from high body fat, is bad because that always keeps our immune system at a high alert, and our immune system is always looking to fight with our own body tissue, right? That's inflammation, gets triggered by excess body fat in the body. Why? Because body fat is not just some inert tissue. Our body fat is actually metabolically very active. It produces hormones and chemicals which cause signaling to our immune system back and forth. The second pathway by which this happens, stress. Our body fat and specifically some foods that we eat, and we will go into more detail later, they produce something called free radicals, otherwise called reactive oxygen species, which damage our DNA. When they damage our DNA, the chances of erroneous DNA mutations go up. That's how, probabilistically speaking, cancers can happen. When the DNA mutation produces an error, right? Inflammation causes the pancreas to produce more insulin, and we will see that insulin and insulin-like growth factors really are at the heart of all of this. Extra fat cells make more estrogen also. I'm sure a lot of you would have heard estrogen as the sex hormone in women. But guess what? Men also have estrogen. They have much lower levels of estrogen than women. But when men have more fat, our fat cells have this enzyme called aromatase, which converts testosterone into estrogen. So now think about this very dangerous scenario where you already have high fat. Now your fat cells are producing even more estrogen from your existing testosterone. Testosterone is required by our body to produce more muscle. So when we have fat, it actually tends to make us even more fat in the future because it inhibits our muscle building capacity by inhibiting testosterone, right? That's because of our fat cells converting testosterone into estrogen. Too much insulin and estrogen cause cells to divide more than usual, right? Our cells start to multiply. The more our cells multiply, every time our cells multiply, our DNA sequence, our genome inside the nucleus also has to multiply, right? Whenever that happens, and if it happens more number of times, just the chance of a bad mutation goes up. A bad mutation is what can lead to a cancer. So if you look at what research says, multiple factors potentially contribute to the progression of cancer in obesity and type 2 diabetes, including hyperinsulinemia, which basically means excess insulin in the body, and insulin-like growth factors, hyperglycemia, dyslipidemia, etc. An important question here, which is, does it matter where the fat is stored in the body? So, if fat is stored under our arm muscle or in our legs, or if the fat is stored in the middle of our body, in our bellies, does it matter? Well, research is very clear. When too much fat is carried around the middle of the body near the stomach, it may be more harmful. Otherwise called the visceral fat, right? Visceral fat or visceral adiposity is much more dangerous from a cancer perspective than subcutaneous fat, which is present under the skin in the rest of the body. Why are we at a higher risk versus other Western races? On the left side of the page, you see an image where you see Dr. C.S. Yajnik, who is the Indian researcher in that picture, and you see his British counterpart called Dr. John Yudkin. They both have exactly the same BMI listed on top of that image, 22.3. The problem is Dr. Yudkin has body fat of 9%, whereas Professor Yajnik has a body fat of 21%. So now think of this. BMI, which is the most prevalent indicator of obesity and body composition, is a very poor metric when it comes to telling us what is our metabolic risk, because our fat could be very different even at identical BMI. BMI only takes into account our overall body weight, right? That includes muscle, it includes bone mass, and it includes fat. So we really have to be careful about how much fat do we have around our belly. In other words, we have to look at waist to hip ratio. And so on the right-hand side of the page, what you see is newly diagnosed type 2 diabetes patients, Indians versus British. We have higher waist to height ratio, WHR, by 5%, right? We have 30% more fat and 1.5 times more insulin resistance, which happens to be the root cause of this. Right. So I hope by now we've all understood that this is heading for a disaster, right? Given the numbers of growth of diabetes and obesity in India, and given the pathways that we just saw, which connect obesity and diabetes with cancer, and the additional risk that we as Indians carry if we are obese or diabetic, we know that this is going to be an unmitigated disaster if we don't start to take some steps soon. All of us, right? Not just the government, all of us are at high risk. What can we do? It begins with understanding the root cause of this disease, which is insulin resistance, which, by the way, is also the root cause of diabetes and obesity and cardiovascular disease, right? So it's not a mystery. It should not be a mystery why all of these diseases are growing unchecked in India. It's because they all have the same root cause, which is insulin resistance. The parable that comes to mind is of these 6 blind men who are touching different parts of an elephant and thinking it's a spear, it's a fan, it's a rope, without being able to see the elephant in the room, which is the real root cause, right? Which is the insulin resistance. It all starts in the liver, right? What you see here is a very complicated image. It's the biochemical pathway of how does the liver treat fructose, which is added sugar, right? Fructose, which you can see on the top left of the page. How does the liver use it? Well, fructose can only be used by our liver. None of our muscle tissues, none of the rest of our body can metabolize the sugars that we eat, right? Unlike glucose, for example. So when you eat roti, when you eat potatoes, when you eat natural starchy grains or vegetables, you are eating glucose, right? The starch gets converted in our body to glucose, which can be used by our muscle tissue, it can be used by our brain tissue, it can be used by all different parts of the body. But if you're eating a lot of these added sugars, so you're drinking Pepsi or Coca-Cola or fruit juice, you're eating cakes and pastries and ice creams and cookies, you're eating a lot of added sugar, right? That can only be used up by our liver. What that means is you eat fructose, it instantly produces inflammation in the liver. That inflammation causes the buildup of lipids, otherwise called fat, in the liver, right? When the liver cannot store this fat anymore because the liver is at the risk of injuring itself because of too much fat, it says, I now need to export this fat into the fat depots in the body through blood, right? That's how we start to see dyslipidemia in our blood test. Dyslipidemia means high cholesterol. Our liver packages this fat, which is being produced in the liver, in the form of lipoproteins with cholesterol and sends them out in the blood to different fat depots in the body. That's why when we do blood tests, we see high cholesterol. What does that mean? Apart from dyslipidemia, it also means that we start to become obese because now we have this fat which is being exported by the liver, which is sitting in all different parts of the body, but primarily it goes and sits in the belly area of our body, right? So this is why what we see in Indians is, even before they become obese in general, they tend to have a beer belly or a paunch or just central obesity first, right? That's why we are at a higher risk. And the reason now you understand is it starts with added sugars. The next step in the process is hepatic IR, which basically means liver insulin resistance. The fructose that we eat also phosphorylates the insulin receptors in the liver cell, which causes insulin resistance in the liver. When the liver becomes insulin resistant, the pancreas starts pumping more insulin to overcome this insulin resistance, which basically causes the rest of our body to also become insulin resistant because they start to down-regulate their insulin receptors. They also become insulin resistant because the liver is exporting these FFAs or free fatty acids to the rest of the body. These free fatty acids sit inside our muscle cells and make our insulin receptors resistant, right? So that's how we start to now become insulin resistant throughout the body. It also causes the production of uric acid, which down-regulates the production of nitric acid and then causes hypertension, right? So in this one page, I hope you have now seen how eating added sugar, and we will look at also the other foods which cause the same problems, how added sugar causes inflammation, how added sugar causes excessive insulin production through insulin resistance, and also how added sugar causes fat buildup, right? So I'm hoping that you are now joining the dots between this page and the previous page, where we showed all of those 3-4 reasons as increasing our risk for cancer. When we eat specific foods, such as added sugar, as well as alcohol, branched-chain amino acids, which are present in excess in animal protein, and number 4, saturated and trans fats. These 4 foods are the primary culprits for causing this biochemical pathway in the liver. These cause inflammation, fat buildup, by the way, fat which converts the androgens, the testosterone to estrogen, and oxidative stress through reactive oxygen species, which we will see on the next page. All of these factors combined with insulin-like growth factors cause cells to divide indiscriminately and become tumors in future, right? We need to start doing prevention at this stage. We cannot wait for the tumors to develop because, like I said earlier, that's already in some sense too late. This, I'm not going to go into too much detail, but it shows again the same biochemical pathway wherein our liver converts fructose into ROS, which stands for reactive oxygen species, right? So like I was saying earlier, 4 foods that cause these reactions. Number 1, added sugars without the fiber. So the reason I mentioned without the fiber here is you eat fruit with the fiber and you won't have this reaction. Why? Because when you eat fiber, that fiber prevents the absorption of the fructose directly into the liver. It actually makes sure that the fructose goes into our small intestine where it gets chewed up by our friendly gut bacteria. So when you eat fruit, which is fructose with the fiber, the fructose does not overwhelm the liver. It gets chewed up by our gut bacteria. So you don't get these toxic pathways by eating fruit. You get these toxic pathways when you eat foods which are rich in sugars without the fiber, right? So that's the fruit juices and Coca-Cola and Pepsi and cakes and pastries of the world, and jalebis and whatnot. The second kind of food that causes this, trans fats, which are present in meat, hydrogenated oils like dalda, dairy, cheese, and bakery items. All of those, by the way, have a lot of trans fats and saturated fats. All of those cause the same sort of reactions. Number three, branch chain amino acids, right? I'm sure a lot of you are thinking about, let's go to the gym and drink whey protein and whey isolate and all of that. Well, guess what? Whey proteins and all of these processed animal protein powders or animal sources of protein are very high in branch chain amino acids. Our liver also treats these branch chain amino acids, which are leucine, isoleucine, and valine, the same way as added sugar and trans fat and saturated fat. The last food that causes this problem, alcohol, right? So no wonder alcoholics are at the highest risk of insulin resistance, diabetes, and liver cancer, right? Because alcohol is a so-called acute toxin for our liver. There are also additional inflammation risks, right? So by no means should we be exonerating smoking. Smoking is the #1 risk factor for lung cancer, for throat cancer, for oral cancers, smoking and chewing tobacco, right? So that is something that we have to quit if we want to prevent our cancer risk. Saturated fats, like I mentioned earlier, omega-6 fatty acids, which are present in a lot of the vegetable oils like sunflower oil, etc., right? Sesame oil, sunflower oil, etc., palm oil, refined carbohydrates, endocrine disrupting chemicals, right? So for example, if you are used to heating your food in a microwave oven in a plastic box, please stop doing that. Heat your food in glass containers or ceramic containers. And lastly, stress and poor sleep also cause additional inflammation in the body. Like I was saying earlier, insulin resistance is also the root cause behind diabetes, right? I guess by this time, all of us already understand that hyperglycemia, which is high glucose in blood, is the definition of diabetes, right? Insulin resistance is what causes that. It is also linked to slow wound healing, fast aging, and several microvascular complications like those of the nerves, eyes, kidney, erectile dysfunction in men, as well as CNS, right? CNS stands for the central nervous system. So nerve damage, basically. Insulin resistance is also the root cause behind cardiovascular disease, which is heart attacks and strokes. 80% of cardiovascular disease deaths happen because of heart attacks and strokes. 30% of all deaths in India currently happen because of heart attack and stroke. So if you are fixing your insulin resistance, you are not just preventing your cancer risk, you are also preventing your risk of heart attack and stroke, and you are also preventing your risk of all of these symptoms and all of the diseases which we saw on the previous page, which is diabetes, pre-diabetes, the risk of kidney failure, vision loss, etc. Let's now look at what should we be doing to prevent these risks from taking root in our body and showing up later in the form of a tumor, worse in the form of a malignant tumor, and even worse in the form of a malignant tumor which has metastasized, right? Because that is stage 4 terminal cancer. We need to be able to prevent these risks from happening. What does the World Cancer Research Fund say? It gives these 10 recommendations. Obviously, we have to be physically active. We have to try and maintain a healthy weight. But what are some of the actionable recommendations in terms of diet and lifestyle? Number 1, eat a diet rich in whole grains, vegetables, fruits, and beans, right? I don't care what your keto coach is telling you. If you're not getting enough vegetables, fruits, beans, and whole grains, you will probably lose weight because of a low carb keto diet in your 3 months, but you will harm yourself unbearably in the long run. You have to I hope this is a no-brainer by now, you have to limit consumption of fast foods and other processed foods which are high in fat, starches, and sugars. You have to limit consumption of red and processed meat. You have to limit consumption of sugar-sweetened drinks, so Pepsi, Cola, all of these. Again, needless to mention, hopefully by now, you have to limit alcohol consumption. Like I mentioned earlier, not smoking and avoiding other exposure to tobacco is almost a hygiene factor at this point of time, right? And I come from ITC. I used to work in a company where we used to produce cigarettes, right? But that being said, we still have to, cut out smoking if we want to control our cancer risk. This page basically shows that plant-based diets are the way to go, right? Plant-based diets are anti-inflammatory and have several phytochemicals which are preventive against cancer. What you see in this chart here, represented in different color bars, when you eat a vegan diet, which is 100% plant-based, so not even dairy, the inflammation levels are negative, right? So it basically controls your inflammation levels. It reverses your existing inflammation levels in the body in 2 months' time. And you can see that as you keep going up, as you keep going away from plant-based diets, your inflammation levels keep going up, right? Semi-veg is probably the worst. What is semi-veg? Eating vegetables most of the time, but also eating a lot of dairy and a lot of chicken and seafood. If you think about it, most of us now are on that diet, right? We are all somehow being made to believe that we should be eating cheese in everything, right? I look at my Zomato menus and I see cheese pav bhaji and cheese samosa and, there's cheese in everything. Guess what? That's terrible. Also because of the specific linkage between dairy and cancer. I want you to read the text which is highlighted in yellow here. In international comparisons, consumption of dairy products is strongly correlated with rates of breast cancer, prostate cancer, and other cancers. In prospective cohort studies, milk consumption is most consistently associated with a greater risk of prostate cancer, especially aggressive or fatal forms. Total dairy intake has been associated with a greater risk of endometrial cancer in women, particularly among postmenopausal women who are not receiving hormone therapy, right? And the text underneath that shows why this is the case. To increase milk production, cows have been bred to produce higher levels of insulin-like growth factors, and they're pregnant for most of the time they are being milked, which greatly increases the levels of progestins and estrogens and other hormones in milk. When we drink that milk or when we eat that cheese or that yogurt, we are also ingesting all of those estrogens, which then start circulating in our blood also, right? This is the direct link between dairy and cancer risk. So it is inevitable that we need to also moderate our dairy consumption. Over the last 2 decades, unfortunately, this has become our diet, right? Lots of cheese, butter, junk food at McDonald's and Domino's, packaged foods which are rich in sugar, and lots of deep fried foods, right? Which are, like I said, full of saturated fat, trans fat, as well as omega-6 fatty acids. We need to go back to our traditional diets, which were rich in whole grains, millets, vegetables, legumes, beans, and spices. One quick point about medical protocols also, like I mentioned, all of this we need to do if we have an ongoing disease. If we have detected or diagnosed cancer risk, we obviously have to be working with our doctor. But it's also important to note that there are some medications, such as insulin injections and sulfonylureas, which we need to bring down in conjunction with our doctors. These medications, as you can see from the chart on the left-hand side, they increase the rate of all-cause mortality, cardiovascular disease, and non-cardiovascular death, even after reducing the HbA1c, which is the glucose symptom marker, right? So we need to work with you and your doctor, if you have diabetes, to reverse the root cause of your diabetes so that you can eliminate these insulin injections, because these injections increase your long-term risk of mortality. On the right-hand side, you see these two charts which show why there are some good diabetes drugs, such as metformin and TZDs, which actually lower insulin resistance. This page, I want to also emphasize that by no stretch of imagination am I suggesting that this is easy to implement, right? Behavior change is hard. It's not easy. And it requires an external coach to support you, to monitor you, and to motivate you wherever necessary, right? We are all carrying these undiagnosed risks. So we need to be able to do comprehensive health analysis so we fully understand what is our health baseline, where do we stand? Because guess what we don't measure, we don't manage, and we don't control. Personalization is important. Our bodies are unique, our preferences are unique, right? So these generic Google guidelines, they need to be individualized to our unique circumstances. There is rampant misinformation out there, right? So how do we make sure that we work with the right coaches who are able to give us science-led advice for safe reversal of these diseases, right? Because there is lots of quote unquote celebrity coaches out there, and they thrive on making recommendations which are there to just garner popularity ratings, right? They make these headlines so that they can get more impressions, more YouTube views. It doesn't necessarily make that recommendation scientifically validated or safe. You need to be working with people who are credentialed and whom you can trust. Lastly, physician coordination is very important. If we are on medications, then we need constant monitoring and support, because we need the health coach to be working with your doctor to avoid any acute complications. For example, going very low in our blood glucose, which is called hypoglycemia. This is where, just to summarize, the Good Health Clinic comes into picture. Our mission, like I was mentioning earlier, is to democratize tech-powered precision health for reversing cardiovascular disease and cancer risks, including diabetes, women's health such as PCOS, and mind health issues, right? We have proven outcomes, as I'll also show on the next page, while reducing medications. Everything that we do is aligned with medical association guidelines, for example, American Heart Association, American Cancer Association, and American Diabetes Association. What we do is aligned with guidelines, and it's based on latest evidence-based science. No risky procedures like surgery or fasts or crazy exercises. Our team is all certified and international. And lastly, we also deploy behavioral psychology for making personalized behavior change happen. This is just some of our outcomes that we have achieved. We've achieved 1.5% reduction, 1.5 percentage point reduction in HbA1c in just 3 months, right? So people started with HbA1c of 8, and in just 3 months, the average HbA1c went to 6.5, which essentially means that they were under the threshold in 3 months of type 2 diabetes. 71% of these members, they lowered medications through their doctors in that time frame. If you compare that with the best-in-class drug which is out there, our outcomes are comparable, yet a lot cheaper, because that drug, which is Ozempic or semaglutide, achieved those outcomes in 10 months. It costs $1,000 per member per month and has listed side effects such as thyroid cancer and acute pancreatitis, right? These are just some of the member success stories, which you can see also on our website, tghclinic.com. And lastly, a lifetime of smiles of you and your family is priceless, right? This is why for Pazcare members only, for our next cohort starting Feb 21st, we are giving this special promotional campaign, which is for 999 rupees only per month. We will accept 15 members only in this cohort for personalized attention and try and work with you on reversing the root cause of your disease, right? So it could be you, it could be any of your family members who has diabetes, who has cardiovascular disease risks or obesity, women's health issues. Only for Pazcare members, please connect with us on the next page and you can avail yourself of this promo campaign, right? Only 15 members for our next cohort starting on Feb 21st. You can reach out to us on our website, tghclinic.com, or WhatsApp us on this number. So with that, let me take a pause and start any questions and answers. Anshik, does that sound good?
Yeah, perfect. So I guess we already had a few questions in the chat box itself. I'll just quickly, take you through it. So first of all, Partani asked if you can suggest the right test to diagnose diabetes and how frequently should we get a test done to diagnose diabetes in time?
Yeah, so I think that's a great question. We always start with a comprehensive lab test for diabetes, which starts by measuring your insulin resistance. So we measure something called HOMA-IR, which, by the way, is not part of most diabetes packages online or which is recommended by most doctors. But we measure that because we know that that HOMA-IR or insulin resistance is the root cause of your diabetes and several of your cardiovascular disease risks, right? So we start with insulin resistance. We obviously measure your HbA1c and your various glucose markers. We also measure your entire lipid panel, including these additional independent risk factors for early heart attacks, such as lipoprotein A and ApoB, right? So when you hear about all of these stories recently about these very young actors and young celebrities who accidentally, out of the blue, get a heart attack, right? There's an independent risk factor called LPA for trying to predict that. We measure those as well. And then every 3 months, we repeat a subset of these tests, because all of these tests you don't have to repeat every 3 months. We repeat a subset of these tests to monitor your progress. So that's our diagnostic strategy.
Thanks, Kamal, for the answer there. Second up is how can we identify ourselves for insulin's resistance? Is there any test to check for insulin's resistance?
Yeah, that's right. So like I was just saying, there's a test called HOMA-IR, HOMA-IR. HOMA, HOMA stands for homeostatic model assessment. IR stands for insulin resistance, right? Homeostatic model assessment of insulin resistance is the most accurate test of your insulin resistance. Anybody can do it. My only caveat is if you are already diagnosed as type 2 diabetic, and if you are already on insulin injections, so if you are type 1 diabetic or if you are type 2 diabetic on insulin injections, then you don't have to do this test because you already know that you're insulin resistant, right? So this HOMA-IR test would not really tell you much more. But if you're not diagnosed, if you're obese, for example, or if you have PCOS, then you must do this test if you want to understand your insulin resistance level.
Perfect. Thanks for the answer again. Next up is, does the type 1 and type 2 have different type of risk factor?
That's right. So they do indeed have different types of risk factors. So type 1 diabetes patients have a problem which is not of insulin resistance. They don't have the problem of hyperinsulinemia. They have the reverse problem. Their pancreas does not produce any insulin, which is why type 1 diabetes patients have to take insulin injections. It's the right thing to do for type 1 diabetes patients only. Type 2 diabetes patients, on the other hand, have too much insulin in their body, right? Which is why they have insulin resistance. And so they carry additional risks of hyperinsulinemia. So if you think about it, type 1 diabetes patients, if their diabetes is uncontrolled and if they are on too much insulin injection, then they tend to also develop the same risk factors of cancers and cardiovascular disease risk and kidney failure, etc. Right? So if you think about it, the root cause of these two diseases is different. But if you tend to have too much insulin, either because your body has too much insulin because of type 2 diabetes, or because you are on very high insulin injections, then you both tend to become on the same risk profile. And so both of you, or both of type 1 and type 2 diabetes patients, need to take care of all of their risks.
Perfect. So next up is it's from Vishali. Is there any side effects to consume external insulins for diabetes, as her father is taking it? So if you can.
Yeah. So Vaishali, that's a great question, and I think this takes us back to that page which I was showing earlier. Think of giving insulin injections, external insulin injections, to a patient who has high insulin levels. What you are essentially doing is you are taking care of his short-term symptoms, but you are worsening the root cause of the disease, which is hyperinsulinemia and insulin resistance, right? Too much. So I hope you remember this one page, which I was showing earlier, which showed that too much insulin, despite taking care of the short-term symptom of diabetes, which is HbA1c. You can see on that chart on the left-hand side, their HbA1c went down by minus 0.88, right? It went down by 0.88 percentage point. Yet, they suffered from more mortality and they suffered from more heart attack. So that's the right-hand side chart, which shows that the dots and the risk profile is all on the favors less intensive side of therapy, right? So if your dad is on external insulin injections, you need to try to get him off of those insulin injections. The way to do that is by working on his diet and lifestyle. That's how he will get off of insulin. That's the story of my mother also, who was on 80 units of insulin on a daily basis, and she was doing that for 26 years. When she corrected her diet and lifestyle, she managed to bring down her insulin injections from 80 to 0. And her diabetes also went down from 8.4 to 6.2. She lost weight, and her other complications also went away.
Great, Kamal. Thanks for the answer. So there's one more question. So if my dad is taking medications for diabetes, are you saying that if we take programs like this, they can cut off from the medication part?
That's absolutely right. So 71% of our program members, they reduce their medications in just 3 months of being on our program. 100% of our members who were on insulin injections managed to cut down on their insulin injections by minimum 50 to 60%. Most of them are able to eliminate all of their insulin injections in a matter of months.
Okay.
I think I'm being quick with my answers just because I know that there's time constraint and I want to address as many questions as possible.
Oh, yeah, sure. So we I guess this is the last question that I can see here. So if we address insulin resistance, then we can reduce the risk of many health risks.
Yes, absolutely. So like we were saying earlier, insulin resistance is the risk for cancer, as we saw through this webinar. It's the risk for cardiovascular disease, so heart attacks, strokes. It is obviously the risk for diabetes, type 2 diabetes, prediabetes, obesity, and all of the complications linked with diabetes, which is kidney failure, vision loss, erectile dysfunction, PCOS in women, nerve damage, Alzheimer's and dementia, right? All of these diseases are linked to insulin resistance. If you reverse that, you will be reversing all of these associated complications.
Perfect. Thanks, Kamal. So there are two questions which are actually related to the program. I'll take it offline with you, and I'll respond accordingly to the
Sure.
guys. And thanks a lot everyone for joining us with here in the session. Post this session around 6:30, you will be receiving a mail from our end, which will be about the feedback. So do share your feedback. And if in case you have any other topics that we can actually cover for our future wellness sessions, we would definitely love to take it up for you.
Thank you.
There's the one last
question. I think, Anshik, just one last.
Anshik, and thank you so much, everyone, for making time on this Friday.
Kamal, 1 second. I
Sure.
think. Yeah, go on, Anshik,
last question. Yeah. How about probiotics in boosting the metabolism?
So probiotics are great, not so much from the point of view of boosting metabolism. So boosting metabolism is a fluid term with varying definition, right? Probiotics, by the way, what is the number one probiotic? Fiber, right? That is the single most important probiotic. So when we say probiotic, please don't go to Amazon.in or to your local pharmacy and buy probiotics in boxes, right? And pay a fortune for those. Just eat lots and lots and lots of vegetables, right? That's the single most important source of probiotic, number one. Number two, eat fermented foods. Apple cider vinegar, for example, has lots of probiotic enzymes in it. It is wonderful from the point of view of helping our gut microbiome, which is what probiotics are primarily for, right? Probiotics are meant to be the food for our gut bacteria. When our gut bacteria are well fed and happy, they secrete these anti-inflammatory factors, such as short-chain fatty acids like butyrate. These short-chain fatty acids not only bring down our inflammation levels in the body, they also are mood boosters. They make us feel happy. They make us feel good, right? So probiotics in the form of fiber is wonderful from the point of view of boosting our gut microbiome. When our gut microbiome is happy, like we were also seeing earlier, when we eat too much sugar also, that gut microbiome with the fiber will be able to prevent and protect our liver, right? So couldn't agree more. You need more probiotics and it will help you in all of these disease risks. But my only suggestion is, please don't think of probiotic as a separate chemical that you should be eating in the form of a pill or a capsule. Please eat real food from plant-based, fiber-rich vegetables, millets, whole grains, fruits, especially colorful fruits, right? Like berries and amla, these kinds of fruits. I think that is what you should be having for probiotics. I hope that answers the question.
Thank you, Kamal. Thank you so much.
Perfect. Thanks, Kamal. Thanks everyone for joining in. I wish you a great weekend ahead. That's a wrap up from our side. We'll be sharing the feedback mail. Do let us know your feedback and have a great weekend. Thank you all. Thanks for joining in.
Thank you, everyone. Bye.